You have the power to make this decision to quit smoking. It took me to get to a mature age where I understood that if I didn't stop, I was gonna put myself in the same position that my mother was in. And I wanted to make a choice while I still had the chance to be here for my daughter.
You can quit. For free help, visit cdc.gov/tips.
I'm Marlene. I smoked and got macular degeneration, so I don't see very well. If this happens to you, you could need eye injections every month like I do. My first tip is, find a doctor that you could trust. My other tip is, before they put that needle in your eyeball, look as far away as possible.
You can quit. For free help, visit cdc.gov/tips.
All right, so these lungs right here look a little different from the healthy lungs that were pig lungs, right? These are supposed to represent smokers' lungs. In fact, these lungs are supposed to simulate lungs of a person who has smoked 1 pack of cigarettes a day for 20 years. 1 pack for 20 years. Now, these are pig lungs. How did they get them to be simulated smoker lungs? Did they make the pigs smoke? Did they put them in a room with lots of smoke over time? No. In fact, according to the package, they infused these with carbon particles, injected dye, and we have some simulated tumors that I will show you soon, so get excited. I'm also going to inflate these for you as well. The first thing you'll maybe notice is a big difference between the other ones is the coloration here. In people who smoke, when they inhale all those particles that they're getting from cigarettes, now people always want to ask me, hey, Miss Ora, what if I don't smoke cigarettes? What if I smoke something different like cigars or marijuana or something else? Still not good for you. You're still, even if you're standing next to a campfire and breathing in the smoke, it's going to cause some darkening of your lungs over time because those particles are going to get infused into the tissue. Not so good. So over the long term, just 20 years of damage right here, you can see visually the lungs look different. On a microscopic level, think of those alveoli. They get damaged. those little centers of gas exchange, those wonderful centers that allow you to get oxygen so your cells can make ATP, those wonderful little air sacs that get rid of that carbon dioxide so that you don't have that waste product in your body, those can be damaged. Why? Why would you damage those? You wouldn't want to. You love ATP. So these lungs right here, sad lungs, okay? Very sad lungs. You can see that this right here is the right lung. This right here is the left lung. Remember, in anatomy, it's as if it's in your own body. So right side, left side. So the right lung has the 3 lobes. The left lung has 2 lobes. I'm going to flip this around to the dorsal side, and I'm going to palpate or feel and then show you the actual simulated tumors, because they are both on the left side. You can see them best from the dorsal view. So here now is the left lung, okay? And if I'm feeling around right in here, I'm going to push this outward. This represents a tumor right here. Smoking can mutate your cells. Smoke has carcinogens or cancer-causing agents. These carcinogens can cause the formation of tumors and cancer like lung cancer. So this tumor right here, which of course is simulated, but there's a tumor right here. There's another large tumor. You can see this. Very large tumor right here. Okay, and this tumor actually blocks some of the airflow to the lungs. So people who smoke have trouble getting oxygen and carbon dioxide exchanged with the environment. And in some cases, they can get these massive tumors that obstruct part of the lungs, so they have decreased lung capacity. Very, very sad. So what I'm going to do for you is I'm going to inflate these lungs, and you will be able to see how the obstruction has caused damage when it comes to filling the air in the lungs. Filling these lungs with air. I'm pumping them up right now. So as you can see on the left side, uh-oh, this part doesn't even work anymore. Why? Because of a tumor. Okay, we'll deflate those. Inflate them again. Let them deflate. I'm going to flip this around so you can see the ventral view. Oh, there go the lungs. And I'm going to inflate them so you can see them from this side. So smokers oftentimes have problems with coughing, with breathing. If you play sports or you try to do stuff athletic and you are a smoker, that doesn't always work so well. The good part about quitting smoking is that if you quit, you can do a lot of good for your body and get healthier. Will you get rid of all these particles that cause all this damage? No, but you will decrease your risk for cancers.
When I found out I was pregnant, I was 24 years old, recently engaged, and a year away from student teaching in college, and still smoking cigarettes. I knew that smoking was bad, well, at any time, definitely while you're pregnant, but I didn't think it would happen to me. I didn't think I would have a premature baby. I thought everything was going to be fine. It wasn't. I went into an ambulance. I was very scared. I felt alone. I felt like I hurt my baby. When my daughter was born 2 months early, she had to be placed on a feeding tube. I was not able to hold her. After she was about a week old, I was able to do skin-to-skin contact, but that was only for less than an hour a day. The only time I was allowed to touch her in her incubator was every 4 hours for a diaper change.
It was very difficult for me to quit smoking. I was so addicted that I smoked morning, noon, and night. I smoked when the telephone rang, when I finished eating, I smoked for whatever reason there was, the light of a cigarette. I even smoked the day of my surgery, right up to the front door of the hospital. And I can remember my surgeon wheeling me in, and he said, "Miss Hall, you had smoked your last cigarette." And I didn't know how he knew I smoked. And after I got out of the hospital, I went home, and the automatic thing to do was to go find a cigarette and try to light it up. And when I did, I immediately saw myself in the mirror and realized, what are you doing? I don't want to have anybody else go through what I've been going through because of my addiction to tobacco and cigarettes. And that's what keeps me going.
I'm Julia. I smoked and I got colon cancer. It made me realize that smoking was the wrong thing to do, so I'm glad I quit. And getting sick was a real bad experience, but it taught me a lesson. You have to think about repercussions and consequences of everything we do. Everything we do. I didn't start off smoking very much, but I got up to a pack a day, which was bad. I don't know, sometimes it seems like you get sick and you feel like maybe it might go away or things might change, but I was still smoking and it wasn't going away and it wasn't changing. It was getting worse. And I wasn't able to really eat like I used to either, because it would just come back up, and then all of a sudden the blockage, and I couldn't go to the bathroom. I went to the doctor. I had made an appointment to go. I went, and I was given a colonoscopy, and when they gave that to me, that's when they found the tumor. And early the next morning, they rushed me into surgery. They removed the tumor. They took out a good bit of my intestines. They left a stoma. It's a part of my intestine sticking through my skin, and that's what you place the colostomy bag over. I had to wear it for a whole year. My digestive system is not good. A lot of bad gas and cramping, and I've had to go to the emergency room many number of times. And it's going to be that way the rest of my life because of the surgery and because of the cancer. I'm going to have to live with it.
I didn't think I would be at risk at such a young age. I thought maybe when I got older or something, when I was like in my 70s or 80s maybe, but not when I was in my early 30s did I ever think I was going to hear the word, you have cancer. And when I started getting the symptoms of the sore throat and everything, I just kept putting it off as, I have a cold or I have this or that, so no, I never, not when I was in my 30s, no.
Smoking dramatically increases the risk of cardiovascular disease, including heart disease, heart attack, and stroke. When cigarette smoke is inhaled, toxic gases pass through the lungs and into the bloodstream, causing every organ to be exposed to these toxins. Tobacco within cigarettes contains nicotine and many other compounds. As the compounds burn, thousands of harmful chemicals are released. Many of these chemicals are known to cause cancer. In the bloodstream, carbon monoxide from cigarette smoke binds to hemoglobin found in red blood cells, and this interferes with the delivery of oxygen to tissues throughout the body. In addition, nicotine and carbon monoxide can damage the inner lining of the walls of the arteries, causing an increased risk of fatty deposits at the injured site. These fatty deposits, called atherosclerotic plaques, can cause significant narrowing of the blood vessels, which can severely reduce blood flow. In coronary artery disease, atherosclerotic plaques within the heart vessels can reduce or block the flow of blood to the heart, possibly leading to angina or chest pain. In more serious cases where the heart muscle is starved of oxygen for too long, an area of the heart muscle may die, causing irreversible damage. This is commonly called a heart attack or myocardial infarction. When nicotine in the bloodstream flows through stimulates the release of a hormone called epinephrine. This hormone causes the heart rate and blood pressure to increase, potentially putting an added strain on the heart. Smoking also increases the risk of blood clots because it causes platelets in the blood to become stuck together. A blockage within an artery, preventing the supply of much-needed oxygen and nutrients. This is commonly known as a stroke. Following a stroke, the area of the brain affected may no longer function normally, possibly leading to disability. In severe cases, a stroke can be fatal.
So how does high blood pressure lead to heart disease? Well, high blood pressure or hypertension is a condition in the body where the pressure inside the arteries is high. The link between hypertension and heart disease is one of the most well-established links in the medical literature. Finding out if you have high blood pressure or hypertension is easy. Your doctor takes a simple measurement, usually at the upper arm, with a blood pressure cuff, and is able to tell you exactly what your blood pressure is. Now, blood pressure varies throughout the day, but in general, if you're resting at the doctor's office and they take a blood pressure measurement and it's above 140 for the top number and 90 for the bottom number, most doctors would consider that having hypertension. The higher it goes, the worse your risk may be. Having hypertension or high blood pressure leads to various changes within the body that helps promote the development of blocked arteries or atherosclerosis. It also promotes the hardening or stiffening of those arteries. Both of those conditions can lead to things like stroke or heart attack, or a weakening of the heart muscle called heart failure. The good news is that treating hypertension or high blood pressure is relatively easy. Doctors have many choices of medications they can give, and lifestyle modifications such as increased exercise and certain dietary choices may help as well. So having hypertension or high blood pressure leads to a lot of changes in the body, which can cause heart disease.